Mike, thank you very much for coming today.
Great pleasure.
It would be very helpful if you would just give us a little bit of insight into where we should now go in terms of the role of research and the role of using NICE and its guidances.
Well, NICE has produced over the last several years, I think it's more than 10 different pieces of guidance relating to physical activity. Next week we launch new guidance on walking and cycling. So there are already tools in existence that are evidence-based, proven to be cost-effective, which can be implemented across the local government sector, across the National Health Service. The big ask, I think, in respect of this is the perennial problem of how once we've got people moving, we keep them moving. That's been the thing which I think as the public health community, the exercise community have struggled with down the years. We know we've got a core group of people who are very active, but there are a lot of people who'd like to be, who do a bit, could do a bit more, and it's about keeping them moving that seems to me to be critical. And there are several elements in that. One, we can draw upon the science of behaviour change to help us, and as I said in my talk, or in the discussion we've just had, that's a critical area and one where we do quite a lot. And second, I think we need, as I also said in the discussion, for everyone to own the problem. We also need to just be a bit wise about some of the great public health successes of the past. They've often taken a long time to bring off. So, for example, with smoking, we knew about the relationship between lung cancer and smoking in 1952. That was when the first paper was published, and in fact there was some suggested literature even before that. It took us to nearly 59 years, I think, to get to a point where we banned smoking in public places. A great success, but it took a long time to get there. It took a lot of persuasion, it took a lot of people, a lot of hard work, and in some ways we're at the same place with physical activity. That is a connection between good health, physical health, mental health. There are benefits to the economy. All these kinds of things are very well known, but making it happen requires everyone, from the politicians down to the frontline practitioner, to keep it going forward.
And if you had one piece of advice to UK Active, what would it be?
Well, it's great to see the new launch, and I think my advice to you is get stuck in there. You could be a really powerful catalyst for organising a cross-party, non-political coalition, which could act as the platform both for the development of research, but more importantly, the development of the practical things that will bring about the kinds of changes that we're all interested in.
Thank you very much.